Governor, are you interested in defending Senator McCain's health care plan?
I am, because he's got a good health care plan that is detailed, and I want to give you a couple of details on that. He's proposing a $5,000 tax credit for families so that they can get out there and they can purchase their own health care coverage. And that's a smart thing to do. That's budget neutral. That doesn't cost the government anything, as opposed to Barack Obama's plan to mandate health care coverage and have this universal government-run program. And unless you're pleased with the way that the federal government has been running anything lately, I don't think that it's going to be real pleasing for Americans to consider health care being taken over by the feds. But a $5,000 health care credit through our income tax, that's budget neutral, that's going to help. And he also wants to erase those artificial lines between states so that through competition, we can cross state lines. And if there's a better plan offered somewhere else, we'd be able to purchase that. So affordability and accessibility will be the keys there, with that $5,000 tax credit also being offered.
Thank you, Governor. Senator.
Gwen, I don't know where to start. We don't call it redistribution in my neighborhood, Scranton, Claymont, Wilmington, the places I grew up, to say that not giving ExxonMobil another $4 billion tax cut this year, as John calls for, and giving it to middle-class people to be able to pay to get their kids to college. We don't call that redistribution. We call that fairness, number one. Number two, factually, 95% of the small businesses in America, their owners make less than $250,000 a year. They would not get one single solitary penny increase in taxes, those small businesses. Now, with regard to the health care plan, you know, it's with one hand you give it, the other you take it. You know how you know how John McCain pays for his $5,000 tax credit you're going to get, a family will get? He taxes as income every one of you out there, every one of you listening who has a health care plan through your employer. That's how he raises $3.6 trillion on your taxing your health care benefit to give you a $5,000 plan, which his website points out will go straight to the insurance company. And then you're going to have to replace a $12,000, that's the average cost of the plan you get through your employer. It costs $12,000. You're going to have to replace a $12,000 plan because 20 million of you are going to be dropped. 20 million of you will be dropped. So you're going to have to replace a $12,000 plan with a $5,000 check you've just given to the insurance company. I call that the ultimate bridge to nowhere.